Hello, John, and welcome to Denmark. I'm colleague to Marianne, and I'm going to welcome here today. Hej alle sammen, og velkommen til den første af 3 webinarer for primært dyrlæger, men også for alle andre, som har interesse i det, omkring kloge. Og John er med os fra New Zealand, så det er tidlig morgen for ham dernede. Og jeg tror, at klokken er ved at være 7:30, så vi starter nu. Marianne, gider du lige trykke ned til den næste slide? Kan I høre mig?
Jeg kan i hvert fald høre dig, Anne.
Nå, det er godt. Marianne, kan du høre mig? Hvad hun er gået?
Ja, jeg kan godt høre dig.
Nå, gider du ikke på videre til næste slide så?
Det er den sidste slide. Det er den sidste slide, vi har. Nummer 2.
Nej. For mig står der nummer 1, den første slide.
Om den er skiftet tekst. Den er skiftet på min skærm.
Jamen, det er den ikke på min.
Nå. Nu er den sort skærm på min.
Okay. Nå, men hvad hedder det? De her webinaren, de er lavet med penge fra Mælkeafgiftsfonden. Jeg tror, det er det, der står på den næste slide. Og så skal vi lige bede alle om at unmute eller mute sig, så vi ikke sidder og hører alt muligt baggrundsstøj. And then, John, I will welcome you. And we're very happy you will get up early today to tell us something about healthy hoofs. And I expect you to introduce yourself.
I will.
Yeah, so you're on now.
Great, thank you. Good evening, everyone. Many thanks for the opportunity to speak to you all. Well, this morning for me, this evening for you. My name is Jon Huxley. So I spent the large part of my career working in the UK as a cattle specialist. In 2018, my family and I emigrated to New Zealand, where I'm currently head of the School of Veterinary Science at Massey University and professor of dairy cow health. So I guess I should acknowledge from the outset that my role is now largely management. So I'm going to now be referring back to what was probably 10 years of research on clawhorn disease that I conducted whilst I was at the University of Nottingham in the UK. And also that research that I left running. So when I moved to New Zealand in 2018, we'd got a number of large projects still running in the UK, and those are just running to a close now. And probably the most exciting of them, I'm going to be able to give you a little bit of information on right at the end, but unfortunately it's only just been submitted for peer review. So we are a little bit tied on what I can say, but really what I'd like to do is just take you through where we've got to with clawhorn disease. So I'm going to try and share screens. Okay, can you just confirm that you're seeing the first slide, please?
Yes.
Great, thank you. So you should have you've got an introductory slide with a picture of the front of my vet school on the front of it, correct?
Yes, but we don't see that as a slideshow, just all the slides. We can see the PowerPoint.
Yes, wonderful.
Yeah.
Thank you. We should, in which case we're all correct. I'm just making sure the technology is working. You'll also forgive me, it is early, so I'm having my first cup of tea of the day, so I'm waking up. So the plan for this evening is just to take you through the changes in our understanding of claw-horn disease, because I think it would be fair to say that our understanding of what is causing these diseases in dairy cattle has changed quite profoundly over the last 10 years. And it would be fair to say that myself and the group that I worked with at Nottingham have been one of the groups really pushing a lot of the changes. We're certainly not the only group. There's been a number of really good quality research groups around the world working on similar areas, but it's led to quite a profound change in our understanding of claw-horn disease. And that's what I'd like to focus on this evening for you. So importantly, to start, what do we mean by claw-horn disease? I'm going to be talking about two principal conditions. The first is white line disease, and there's effectively two ways that we see white line disease. The first is the mild form, which is white line hemorrhage. And the second is white line separation. Now, I always think as clinicians, this is what we think of when we think about white line disease. You know, we think about these separations of the white line, and we think about the abscesses that result under the sole. One of the things that a lot of my early research really taught me was that this is how the disease presents early in its course. So if we identify cows early, the first thing we see is white line hemorrhage, and we'll come back to that. So that's white line disease. And then secondly, the other condition we're talking about is sole hemorrhage, leading to sole ulcer. So there's, again, it's effectively two different manifestations of the severity of disease. So early in the course of disease, we'll see these areas of sole hemorrhage. And then the really extreme manifestation is sole ulceration, where we see a complete deficit in the sole. So here's probably a really nice example. We've got this round punctate lesion.
Excuse me, John.
Yes.
I think we only see an overview of your PowerPoint. We don't see the actual slide that you're showing.
Ah.
So we only see
Hang on. Let's try again. Thank you very much, Kurt. I appreciate that.
You're welcome.
Is that better? Are you now seeing a single slide?
Yes, it's much better.
Right, sorry, I apologize. So in which case, let's very quickly just review those pictures. So we talked about white line hemorrhage a few minutes ago. So here's the white line hemorrhage and then white line separation. And then sole hemorrhage leading to sole ulceration. So here is probably the most severe manifestation of claw-horn disease, when we see this complete deficit in the sole, and then we see an area of soft tissue protruding through the deficit in the sole. But again, my early work really highlighted to me, where I started as a clinician before I became focused much more on research, that this is the early manifestation of sole disease, sole hemorrhage, whereas we very often as clinicians get asked to treat these animals, but this is the end stage of disease. So anyway, those are the conditions I'm going to be talking about this evening: white line disease and sole hemorrhage stroke sole ulceration. And I consider them, from a research perspective, I consider them one and the same disease in terms of underlying etiology. So a lot of the work is now suggesting that there is differences in why they occur, but the underlying etiopathogenesis is actually very similar between the two conditions. I'm going to show this slide a few times as we go through the presentation, and because it really illustrates the anatomy of the claw extremely well. So this is a sagittal section through a claw. It's been bandsawed down the middle to show the internal anatomy. The first area I would like to focus on is this area here, the thin layer of germinal epithelial cells. There's a thin layer of germinal epithelial cells just here, which are responsible for producing the sole and the white line. So it's only 1 millimeter or 2 thick, but their role is to act as the germinal cells, which eventually lead to the creation of the sole horn and the white line horn. Now, they are a critical layer of cells for us, because without them, the sole and the white line won't form. And if you just think quickly about the anatomy, this is a really terrible place to be sat if you are a critical layer of germinal epithelial cells. And I'll show you some slides in a minute, but they are stuck between the ground underneath the sole, which has got very little give, and then the distal phalanx above them. So this whole area here is only about 6, 7, 8 millimeters, and we've got this very thin layer of germinal cells. They are critical to us. I also want to point out, while we're on the slide for the first time, the digital cushion, which we'll come back to talk about, this pad of fat, which lies underneath the distal phalanx, between the distal phalanx and the sole horn. And finally, these strong collagen attachments, which anchor the distal phalanx into the claw capsule. So there's some really strong collagen attachments that anchor all the way to the animal, to the inside wall of the hoof. It's a strong collagen attachment. So fundamentally, when we think about clawhorn disease, it's actually a pressure lesion, because what we see is damage to the germinal epithelial cells, that thin layer of germinal epithelial cells, caused largely by the body weight of the animal. So again, if you think of the biomechanics, all of the weight of the animal is bearing down through the limb, through the skeletal architecture, and is bearing down through P3. So this thin layer of cells underneath P3 are at significant risk of being squashed, fundamentally. It's a pressure lesion. So the only thing that really protects them from being squashed is this very strong anchoring between the distal phalanx and the internal hoof capsule, anchoring them to the wall. That suspends all of the weight of the animal onto the wall and protects this thin layer of germinal epithelial cells. But they are at risk of being under pressure. And that's how we see disease forming. So if that thin layer of germinal epithelial cells is squashed because of the pressure, the first thing they will do is that they will hemorrhage, or the soft tissue in that area will hemorrhage. And that hemorrhage will then be incorporated into the sole or white line as those structures grow. So if we mildly squash these germinal epithelial cells because of the pressure bearing down on them, we'll see either sole hemorrhage or white line hemorrhage. If we really squash them extremely badly in a small area, that's when we see the formation of sole ulceration. So there are specific reasons why sole ulcers occur in the location they do, and it's because of heel strike in the walking animal. So at heel strike, this area here, because of the heel strike lands just on the caudal aspect of the distal phalanx, and that causes a specific area of pressure just about here at heel strike, and that's why we see the sole ulcer developing. It's the extreme manifestation of what is fundamentally a pressure lesion. So that's, in many ways, that's the straightforward bit. So our understanding of this has been established for decades, actually. We understand that this is a pressure lesion damaging this thin layer of germinal epithelial cells. Here's a picture that's been in my collection for 30 years, actually. It's a very old picture, but for me, it perfectly illustrates the process of disease if you're lucky enough to capture it in sagittal section. So here you can actually see the necrotic corium. You can see the damage to the germinal epithelial cells here, caused by this bony lump where the flexor tendon is inserting onto the distal phalanx, and you can actually see the sole ulcer growing through the sole. So fundamentally, it's a pressure lesion. Now, there's only two things we now need to understand, because the first thing that people then ask is, in which case, if it's a pressure lesion, why do we see it in different locations, and why do we see it on different claws? So I'm going to answer those two questions before we move on. So why do we see it manifesting as both white line disease and sole hemorrhage or sole ulcer? I'm going to take us back to a really nice piece of work published nearly 20 years ago now by Christoph Liescher and others from a research group in Zurich. And I'm going to refer to this paper a few times because it's a beautiful piece of anatomical work that taught us a lot about what we understand. And I'm going to focus on this line here from one of the figures in that paper. And it says the increased mobility of the third phalanx within the claw capsule due to changes in the elastic properties of the collagen tissue, we'll come back to that, leads to contusions of the corium, mainly under the abaxial and plantar edge of the third phalanx, opposite to where sole ulcers develop. The arrows indicate the direction of force acting on the pedal bone in A, a standing cow, and B, a walking cow. So it was just a really nice piece of anatomy where they worked out where the forces were acting. And in the standing cow, it's the edge of the pedal bone, which is trying to squash the germinal epithelial cells over the white line. And in the standing cow, most of the pressure bears down through the sole, particularly at the sole ulcer site. So that's how we can explain both white line disease and sole hemorrhage and sole ulcer using the same underlying theory. Secondly, we now need to talk about why the most severe manifestations of disease occur on the outside claw, the lateral claw of the hind limb. And again, if we go back to the fact that this is a pressure lesion, all we need to do is understand where we see the most pressure acting through the claws. So why is it hind limbs? Well, it's hind limbs because more weight is borne by the hind limbs than it is by the forelimbs. So if this is a pressure lesion, the hind limbs will always be at greater risk. Why is it the lateral claw? Well, again, I'm going to take us back nearly 20 years to one of the first really good quality pieces of work published by Rick van der Tol and others from Utrecht, which looked at ground reaction force in the standing and walking cow. So this was when pressure plates were first becoming available. And what pressure plates allowed us to do was to look at the ground reaction force of limb loading in the standing and walking animal. And again, I'm just going to read a section from the discussion. It says, whilst walking, in the forelimbs, the vertical ground reaction force was equally distributed between the medial and lateral claw. But again, remembering that less weight is borne by the forelegs. In the hind limb at heel strike, the force was exerted almost completely to the lateral claw. During the rest of the stance phase, the load shifted towards the medial claw until at push off, it was more or less equally divided between both claws. So what that work demonstrated was the point of maximal force in the walking animal, which is when we're going to see the maximum force, because in walking, the animal is physically driving itself forward. So that is the point when the claw is under most pressure. Almost all of the weight was borne by the lateral claw and the heel area at heel strike. So that explains why the most severe manifestation of clawhorn disease occurs on the lateral claw of the hind limb, even though all 8 claws of all 4 limbs can be subject to the pressure that we are talking about. So fundamentally, what we need to do to understand clawhorn disease is to understand what causes excess pressure on that thin layer of germinal epithelial cells in the claw. So what causes excess pressure on the dermis, that thin layer of tissue underneath P3? And this is where we've seen quite a profound change in our understanding of disease. Because this was, the laminitis theory has been and was the predominant theory as to what the underlying cause of disease was for nearly 50 years. But it's now increasingly being discounted. So I now discount this theory completely, but it would be fair to say that I'm one of the people who's been really pushing this and leading this with some of the what we've been doing, but also in my own research on the subject area and my own beliefs in what's happening. And I'll tell you why I now completely discount this theory. So we have over the last 5 years, we've conducted 2 full literature reviews looking at the background to clawhorn disease. So that's gone all the way back through the literature. I've asked 2 of my PhD students to do this work independently, and they both came to the same conclusion. So firstly, we can trace the laminitis theory back to a PhD published in Stockholm in 1963. So literally you can follow the story all the way back through the literature and the textbooks to this PhD by Nielsen, published in 1963. And as I'm sure many of you will know, the theory went something like this. High concentrate diets led to rumen acidosis. This is where it got a little bit sketchy, but rumen acidosis was meant to cause bacterial cell death and the release of endotoxins from the rumen, which had impacts in the feet, leading to laminitis, inflammation of the laminae in the hoof. That led to increased movement of P3, and that increased movement of P3 is what damaged the germinal epithelial cells, causing lameness and clawhorn disease. However, there's 2 fundamental flaws to this theory that's been around for a very long time. Firstly, laminitis, as in inflammation of the laminae, does not seem to be a component of disease when you look at this experimentally. Secondly, it has been almost impossible to reproduce this etiology experimentally. So a number of people over the years have tried to experimentally induce this theory to demonstrate that it causes disease, and nobody has managed it. So first of all, I got to the point where I go, well, if a theory has been there for 50 years and it remains unsubstantiated, there comes a point where we probably need to be thinking, is it right? Now, the problem we've got is this theory made its way into the textbooks and became absolutely the received wisdom as to what was going on, despite the evidence behind it being extremely limited. But that, of course, is one of the problems we have in cattle medicine, and the amount of research that actually goes on to underpin all our thinking can very often be quite minimal. However, what we can absolutely say, we absolutely can say with certainty, and there's a great big range of studies which have demonstrated it, that high concentrate diet feeding is associated with clawhorn disease. So these 2 things at the top and the bottom are very definitely correlated. A number of studies have demonstrated that over the years, that when you feed a lot of concentrate to dairy cows, you are more likely to see clawhorn disease. The problem is the bit in the middle remains completely unsubstantiated. Now, I work with a lot of epidemiologists, and one of the absolute golden rules of epidemiology is correlation does not imply causation. So just because two things are correlated does not mean that one thing has led to another. And I'm going to demonstrate that slightly facetiously with this graph, which is the per capita cheese consumption of the United States correlated with the number of people who died by becoming tangled in their bed sheets. Now, there is no doubting those two things are highly correlated. You couldn't, all of the statistical analysis will demonstrate those two things are highly correlated, but that doesn't mean that one has caused the other. And so this is what's caused spurious correlation. This is just two things by chance that happen to be correlated. If you're interested in this sort of thing, there's a number of these, and some of them are very funny. You just go to tylervegan.com, and there's a number of these spurious correlations. Spurious correlations are much beloved by politicians because very often they can be used to prove a point, even though scientifically there's no rationale for the two things being correlated. So absolutely high concentrate feeding is correlated with Clawhorn disease, but that doesn't mean the two things, one has led to the other. And so again, in terms of what I'll be saying in general in this evening's presentation, this is one of the things that I would really like to get across to you, is that our understanding of what is causing disease has changed over the decades. So historically, we would have talked about Clawhorn disease as predominantly being a nutritional disease, but absolutely acknowledging the mechanical components. Now, increasingly, all the research is suggesting this is predominantly a mechanical disease with aspects of nutrition being important. So whilst I am one of the people who's really pushed the idea that rumen acidosis and laminitis is not causing disease, that doesn't mean to say that nutrition isn't important, because it is in a number of different ways. So therefore, if I'm saying that historic theory is no longer correct, what I obviously need to do is I obviously need to take you through what we think is causing excess pressure on the dermis. And I'm going to talk about that in three principal areas: environmental factors, the carving effect, and then changes to the normal structures in the hoof. And I'm going to go through them one at a time. And we will start with environmental factors. So this is a huge area, and it's not one that I'm going to spend long on tonight, not because it's not important, but because this has been well researched. We understand what a lot of the environmental risk factors are for Clawhorn disease. I'm also not going to spend long on it because I suspect the important factors for you in Denmark will be different than what they are certainly for cows in New Zealand, but also even between the other more intensive systems of Europe, because there will always be differences between farms. It's a huge area. I'm going to briefly talk about it. But firstly, number one, the first thing we need to remember is concrete is a complete nightmare for cows. There isn't a single cow in the world who thanks us for keeping them on concrete. Concrete is there for our benefit, not for the animal's benefit. It's a terrible surface to keep animals who have hooves designed in an evolutionary context, have been designed to walk on soft underfloor conditions. We now keep them on this substrate with absolutely no give in it whatsoever. So if we look at probably the number one risk factor for cows in intensive systems, it's concrete. And that's why, of course, we would then go on to talk about lying times and getting cows off their feet with good cubicle comfort. But concrete is the underlying problem in the system. And so straight away, if you want to understand one of the reasons that high concentrate feeding is correlated with Clawhorn disease, this is why. Because as our systems have intensified, we've gone for higher yields, feeding more concentrate, but also keeping cows on concrete for longer. So that's one of the explanations for why high concentrate diets and clawhorn disease are correlated, even if they aren't directly causing, one isn't directly causing the other. So that's concrete. We could spend hours just talking about concrete. Of course, in the more pasture-based systems, or in the split systems where cows are housed both on concrete and on pasture, the walking surfaces to pasture will be important. And I've hopefully given you two extremes of how it shouldn't be on the left and how it should be on the right. But walkways to pasture will be important. And of course, I will include hoof overgrowth in environmental causes, because if we have hoof overgrowth and disparity in weight bearing between the claws caused by excess hoof, we will also see changes in the pressures acting on that thin layer of germinal cells. So that's environmental factors, and it's a huge area. I want to be really clear and say the fact I've only spent 1 minute talking about it does not mean to say it isn't a hugely important area, but it hasn't been the focus of my group's research, and it's well established in the literature, and that area of the literature is largely correct because most of it is underpinned by research. I'm going to say one important thing, which is the relative importance and overall risk of different environmental factors will vary depending on the management system. I get slightly frustrated when we try and take environmental risk factor management programs, we lift them from one system and try and say, well, you just need to use this system because it will identify the risk. You are the experts in environmental management in your systems, because the environmental risk will vary a little bit, system to system and country to country and farm to farm even. So that's environmental factors, really important. I know I've gone over it quickly, but it's not because it's not important, it's because I want to focus on other areas. Next, we come to the calving effect. So this is something that has really come through strongly through the literature over the last few years. And so I just want to spend a little bit of time on it. So what do we mean by the calving effect? I'm going to start by stating the obvious, and depending on the audience, I will do this slightly more facetiously, but to a veterinary audience, I tend to stick to it. But, you know, basically this calf, this large singleton offspring, should not normally fit through the reproductive tract. The birth of large singleton offspring in mammals, so that's cattle, horses, humans, all of the species which have largely single offspring, it's a remarkable process, but it is incredibly destructive. In order for the calf to fit through the reproductive tract, we have to see this very profound degradation of all of the connective tissues in the pelvis and the associated soft tissues of the reproductive tract, because it shouldn't normally fit. And so something has to happen to allow it to fit. And what happens is we see this release of, and it's not completely understood how it happens, although it's increasingly being described. We see the release of a range of factors which degrade collagens and other connective tissues in the reproductive tract. And that allows the birth of this calf. Now, that's all well and good if the only thing we're trying to achieve is the calf squeezing through the reproductive tract. However, I'd like to take you back to this slide where we started and remind you that the distal phalanx is anchored really strongly to the wall of the hoof capsule by strong collagen attachments. So it's anchored really tightly. So the two grip each other really strongly, and that's what transfers the load. So as the load is being transferred down through the skeleton and down through the distal phalanx, it's then actually transferred largely onto the wall of the hoof because of this very strong collagen attachment between the two. Now, the problem we have is that the events which degrade the connective tissues in the reproductive tract are whole of body effects. So at the same time they also degrade the collagen attachment. And here we can see the blue collagen fibers is here's P3. So the blue collagen fibers, we can see these long straight collagen fibers anchoring through the lamellae to the hoof capsule. Unfortunately, the carving effect also degrades those strong collagen attachments. And this was beautifully demonstrated, again, in a piece of work. It's about the same time, it's about 20 years ago, by a group in Bristol, which demonstrated that the force required to tear the hoof capsule away from the underlying tissue was less at the point of carving. So they physically demonstrated that the collagen was damaged at carving. And that leads to increased movement of the distal phalanx within the hoof capsule around the time of carving. And so fundamentally, this now is one of the absolutely critical interactions leading to the formation of disease. So it's the carving effect which causes laxity in the hoof capsule. But at the same time, we then expose these freshly carved cows to significant environmental factors. So again, depending on the system, we keep our dry cows either at pasture or very often on deep straw beds. We allow them to calve, so they suddenly see laxity in the attachment in the hoof capsule, and at the same time, we expose them all of a sudden to the significant environmental factors as they come into the milking herd. Now, that is likely most profound for first calf heifers, because they are then moved into an environment, the lactating herd environment, that they're not familiar with. So they have the lowest lying times, they're the smallest animals, they get bullied, they stand on concrete for longer. So actually, this interaction at first calving is what we now believe is one of the significant initiators of lifelong clawhorn disease. So yes, it's the environmental risks which are leading to pressure, excess pressure on the thin layer of germinal epithelial cells, but it's initiated by the slackening of the collagen tissue in the hoof at calving. So this is an absolutely critical interaction, and we might come back to talk about that at the end. Then finally, the other thing that's changed a lot over the last few years is our understanding of what then happens to the structures in the hoof because of this interaction between the carving effect and environmental factors. And that's what I'd like to just finish off talking about. Because again, that's where a lot of the work has concentrated, or certainly a lot of our work has concentrated over the last sort of 8 years as we try to understand what is going on. So now I want to focus on two things. Firstly, the digital cushion, and secondly, the distal phalanx. So the digital cushion. Here's another image from that paper by Christoph Liescher and others from 20 years ago. I can tell you exactly where I was sat in a conference when I first heard Christoph present this work. It completely changed my thinking of lameness. It was one of those beautiful light bulb moments, and I can literally tell you the seat I was sitting in because it had such a profound effect on me as a clinician at the time. So what the Zurich group did was they did the first really detailed and anatomical dissections of the hoof and first described the digital cushion. And so they described these 3 pads of fat which lie underneath P3, between P3 and the sole. And when Christoph first described this, I remember him talking about it, saying it's a little bit like the air cushioning in a training shoe. I mean, it's a beautiful way of describing it. It's not quite right because it's fat, and fat isn't compressible. So it doesn't, cushioning isn't quite the right word. It's force dissipating, certainly, but it's not cushioning, probably isn't quite the right description. But it's still a beautiful piece of work that I refer to a huge amount. So again, here's some pictures of the digital cushion, this time taken by computed tomography. and reproduced from computed tomography, some work that we did a few years ago. And you can see these 3 pads of fat lying underneath P3. Now, the thing that really got us interested in the digital cushion was an initial paper by a group from Cornell, which demonstrated that the thickness of the digital cushion was correlated with body fatness. So thin cows had thin cushions and fat cows had fat cushions. Now, if what we think happens is that the digital cushion's primary role is force dissipation. So at heel strike, the animal lands on this area here effectively across the back of the digital cushion. And the digital cushion acts as a force dissipator and it transfers the load onto the wall. So it expands outwards and transfers the load during limb loading onto the hoof capsule wall. So its job, again, is to protect that very thin layer of germinal epithelial cells from the maximal forces which are applied through the hoof capsule when the animal stands and walks. Now, of course, this first piece of work demonstrating that body thinness and thinness of the digital cushion were linked asked some really interesting questions. And this is the question that was proposed by the Cornell group at the time. They effectively said, do lame cows become thin or do thin cows become lame? Because we know that thinness and lameness go together. So we very often see thin, lame cows. And at the time, I think we all assumed that what happened was animals became lame, they stopped eating, or their dry matter intake dropped, and then they lost body condition. So we saw thinness and lameness together. However, this first paper asked a really interesting question, which was, if the digital cushion protects the germinal epithelial cells, if the digital cushion is thinner, is it a risk factor for animals developing clawhorn disease? So actually, is this a vicious cycle? Do we see loss of body condition for whatever reason, leading to thinning of the digital cushion, which in itself causes lameness, which then impacts on nutrition and makes animals even thinner? So this is a self-perpetuating cycle. And the answer is, yes, it does. A number of papers have now demonstrated this. We've probably published more than any group. We've probably I can't remember, 5 or 6 papers we've demonstrated this association. So thinness precedes the development of lameness. So being thin is a risk factor for becoming lame. I want to take you through what I think is one of our best studies on this, because it's a prospective longitudinal study, and just some of the results we found. So this is a longitudinal study through lactation. So what we did, we followed 185 cows in 2 herds across lactation. So we examined them at 5 time points: when they were dry, immediately after calving, at peak yield, and then mid lactation and end of lactation. And at each of those 5 time points, we ultrasound scanned the thickness of the digital cushion, and we also ultrasound scanned their body fatness, so we could assess how much body fat cover they had, and we body condition scored, weighed them. We did a lot of individual assessments, but we ended up with a lot of data at these 5 different time points. Now, this is a really powerful study because it allows us to prospectively see what happens. And what that study demonstrated was, first of all, that digital cushion thickness was predicted by back fat thickness, but only in some cows and at some time points. I'll come back to that in a second. But largely, it is right that digital cushion thickness is predicted by back fat thickness. So fat cows have thicker cushions, thin cows have thinner cushions. However, what it also demonstrated was that the relationship did not apply immediately after calving. And it also demonstrated the digital cushion was thicker when a lesion was present. And I'm going to come back to both of those points. In terms of clawhorn disease, The study also demonstrated that sole ulcer and sole hemorrhage were predicted by thin sole soft tissue thickness at previous examination, thinness at previous examination, body thinness, and loss of back fat between previous examinations. So all the things we would expect. Thin animals, animals which were losing condition, or animals which had thin sole soft tissue thickness, all were at increased risk of sole ulcer and severe sole hemorrhage. So it seemed to all make sense. Here's a graph I just want to spend 30 seconds on, which is the graph. It's all 185 cows in the herd, and the top line is back fat thickness over on the right-hand scale, and this line at the bottom is digital cushion thickness using the left-hand scale. So what this basically demonstrates is that digital cushion thickness tracks back fat thickness except for at calving. So at calving, the two just stop being in line with each other. And we can explain that because that's the calving effect. So now what we're seeing is degradation of the collagen tissues in the hoof at calving, and that is leading artificially to a thinner digital cushion because the distal phalanx is sitting lower in the hoof capsule because of the calving effect. So again, it pointed to the calving effect being really important. I want to move on, but I wanted to leave by saying again, all of the research demonstrates that this is a self-perpetuating cycle. So we do see this. So thinness is a risk factor for lameness, and then lame cows drop their dry matter intake and therefore become thinner. So it's a self-perpetuating cycle. I'd now like to talk about one of our most recent studies. So this is a 2021 Journal of Dairy Science paper, which has just been published. And what we've done this time with the digital cushion is used a research grade 3 Tesla MRI scanner to look in detail at the fat in the digital cushion. So this is data from 102 cows in a UK research herd. So it's now the one remaining, the herd they're from is the one remaining really intensively monitored research dairy herd left in the UK. There are some, but this one is the most intensively monitored. If animals blink, it gets recorded. So it's a fabulous data set where they've recorded everything about these animals over a long period of time. Now, what we did in this study was we collected the hind feet from cows as they were culled from the herd. So they went to the abattoir at cull and we collected their hind feet, we froze them, and then put them through a 3 Tesla research grade MRI scanner to look at the digital cushion. There are now some really good quality MRI programs that allow you to specifically pick out different tissue types. So the image you're looking at now is just with fat picked out in the MRI scan. And so you can see the digital cushion on MRI. This was a really interesting study. It showed, it really said some very interesting things. So firstly, in these 102 cows at slaughter, here is a histogram of the amount of fat in the digital cushion. So this is the volume of fat in the 2 lateral claws of the hind feet at slaughter by the number of animals. So first of all, you'll see we had one animal with no fat in the lateral claws of their hind limbs at slaughter. And we had one animal with nearly 30 mils of fat in the digital cushions of the lateral claws. The average in this population was somewhere around 15 to 20 mils of fat in the lateral claws of the digital cushions. And I want to show you the pictures of what the differences look like. So I'm going to show you 3 pictures labeled A, B, and C, and they are animals in this part of the histogram. So we're going to see an animal with no fat. The maximum amount of fat will be C, and then an average animal in the middle. So here's the animal with no fat in its lateral claw, in the digital cushion of its lateral claws. So you literally have some animals where the digital cushion or the fat in the digital cushion isn't present at all. Here's the animal with 30 mils of fat in the lateral claws, the digital cushion lateral claws, and here's the one in the middle. So you see profound differences in the amount of fat in the digital cushions. The other thing this study demonstrated, because we have all of the history of these animals when they were alive, is that the volume of fat in the digital cushions at slaughter was negatively correlated with the number of lifetime lame events and the number of claw horn lesions that they'd had recorded during life. So animals with a lot of lameness and a lot of lameness caused by claw horn lesions had less fat in their digital cushions at slaughter. So there was a strong correlation between the two. So what this is suggesting is that the two things are linked. Now, the problem we have, because this is a cross-sectional study, we can't attribute the direction to the causality. So, and the trouble is both directions work. So it could be that animals which suffer claw horn lesions, that leads to scarring of the digital cushion and loss of fat from the digital cushion. And that's why we see this correlation at slaughter. Alternatively, it could be that there are some cows, probably because of genetics, who have less fat in their digital cushion genetically, and it's that predisposes them to lameness. In either of those scenarios, we would see the results we found in this cross-sectional study. But it's really important to our understanding of what is going on, or at least it's helpful. What we really now need is a longitudinal study with MRI, but those we've tried to work out how we would do it, and it's just almost impossible. I then want to take you back to this, again, another diagram from this paper by Christoph Leischer and others from 20 years ago, where they'd identified something similar on a small population of cows using dissection, where they also, in a cow with a sole ulcer, this was the B demonstrates the diagram they produced from the digital cushions that they dissected out of the animal. They found less fat in the claws of animals with a sole ulcer present, as opposed to the normal healthy digital cushion. So there is something going on with the digital cushion. The next thing I want to talk about briefly is bone change, because we also know that the distal phalanx changes. So normally what we would expect to see in the distal phalanx is this lovely flat surface. But what we do know is that we see lots of new bone forming on the distal phalanx in some animals. So there's a number of people around the world, lameness researchers, who have lovely boiled out specimens showing new bone formed on the distal phalanx. We did a study using research grade computed tomography, where it allowed us to quantify the exact volume of new bone on the distal phalanx. So the study design was very similar to that I've described for the MRI scanning paper. This time what we did, we collected the hind legs at slaughter from that same research herd, and we put them through CT to quantify the amount of new bone. And that study demonstrated that the amount of new bone was positively correlated with two things. Firstly, the age of the animal, so older animals had new bone, but secondly, the amount of claw horn disease they'd had during life. So if an animal had lots of claw horn disease, they had more new bone on P3. Now, this one I'm more comfortable to say, for me, there really is only one plausible direction of causality. So what this work implies is that an claw horn disease event, so a case of white line or sole ulceration, leads to the formation of new bone on P3. And of course, that's highly problematic for us, because if the new bone forms on P3, this thin layer of germinal epithelial cells is now much more likely to get injured and damaged during standing and walking. So what we're seeing is this downward spiral. So when an animal has a case of lameness caused by clawhorn disease, we see changes to P3 and probably also to the digital cushion, which then means they are at increased risk of future cases of clawhorn disease. So we've got this downward spiral. This is one of my key messages for you today, is that all of the latest work is suggesting that clawhorn disease is a downward spiral of events. So animals have a first case, and from that point on, they are at increased risk of future lifetime cases. And that fits with what we see clinically on farm, because that explains why disease is predominantly seen in older cows and animals which have had previous lameness events. So we know that to be true. As clinicians, that's what we see. Secondly, once disease becomes chronic, cows are more difficult to treat and less likely to recover. I love treating lame cows. It was when I was doing a lot of clinical work, it was one of the things I really enjoyed doing. But I used to get frustrated by some of the chronic cases that would be put in front of me, how I couldn't get them right, no matter what I did. So I could trim them and I could block them, and they would put a hoof block on the sound claw, and they would walk better for a while, but quickly they would deteriorate again. But that fits, because if we're seeing all of this new bone forming and degradation of the digital cushion, it doesn't matter what we do as clinicians, we're never going to get these animals right, because we can't undo the new bone and we can't undo the damage to the digital cushion. And finally, it explains why it often takes time for the benefits of herd intervention programs to become apparent. So if you walk onto a farm today and put in a really high quality herd intervention program, which reduces risk factors from the environment, the only cows which will benefit are the heifers which carve into that herd, because all the animals currently in the herd are already on this downward spiral of disease. And so it can take years actually before you would see the benefit of that program come through. So I'm coming to the end. I want to finish off by briefly talking about the role of inflammation, because the other thing that has really come through strongly over the last few years is that inflammation is important. And the reason I say that is, first of all, that new bone is almost exclusively an inflammatory disease. So when you see new bone, it's almost always because there's inflammation. So what we now think is happening is there is a lot of inflammation at the site of the clawhorn lesion. Now, that, when I think about that, every time I say it, I think, well, that should be obvious. Of course, if you think about it, it's likely to be have an inflammatory component. Second piece of evidence is this piece of evidence where we demonstrated that the digital cushion was thicker when a lesion was present, and we think it's because of inflammation, swelling, when a lesion is present. And thirdly, the results of some of the studies using non-steroidals for the treatment of disease. This is one of ours from 5 or 6 years ago, where we demonstrated that the best outcomes for treating clawhorn disease was when we added non-steroidal to the treatment plan. It's an inflammatory condition. Clearly, non-steroidals will help. So the role of inflammation has really come through. So as I draw to a finish, these for me now are the three key factors. We've got this critical first interaction between the carving effect and environmental factors, which then is exacerbated by changes to the normal structures in the hoof. Now, we've published, I don't intend to go through it, but we've published what we think is now happening in an open access JDS article, and that sort of describes what we now think is happening. And as I say, I think everything is now pointing to the fact that this is now much more a mechanical disease with some nutritional components versus what we thought historically. But it's this downward spiral of events which occurs. So to finish up, I just want to say where the next 10 years will take us, because there's ongoing research now working off some of these, well, moving on from some of this initial work, because clearly what we need is things that we can do on farm. I think for me, this is one of the first important ones. I don't know whether the video will work very well over Zoom, but what I'm showing you is a chronically lame cow. We have a situation where this is the accepted norm. As clinicians, we see these chronically lame cows. When you ask farmers about lame cows, they describe these chronically lame cows to us. All of the work is suggesting that this is the animal we should be concentrating on. So this is a dairy heifer going mildly lame for the very first time. So it's really difficult because we have to treat the chronically lame ones, but all of the work says that early intervention in these very mild cases of disease is how we will see impacts on farm. So early and effective treatment. Secondly, I expect we'll see lots more work on the digital cushion. Increasingly, I suspect this is a genetic thing. So some lines of cows have thicker cushions, and I'm sure we'll see lots more work on the digital cushion. This is a really horrible picture of my feet from 10 years ago, but it's to remind me to talk about conditioning of feet. So 10 years ago, I walked the length of the UK. So I walked 1,500 kilometers over a 5-week period, and I walked 1,500 kilometers in training for that 1,500 kilometers. So I walked 3,000 kilometers over a relatively short period of time. And this is what my feet looked like at the end. They were really, really disgusting. But what I put this picture up because what it highlights is that the foot is a dynamic structure. It can respond to the forces which act through it. And all of this work is now suggesting that we may be able to precondition the feet of particularly dairy heifers, so they are better able to cope with the pressures they experience immediately after first calving. And we might want to talk about that, but that's a really hot area at the moment. And finally, I want to just flag this study because I'm really excited to get it out, to get it published. It's the best study I've ever designed and set up in my career, and it's led to some really exciting results. So we've recently finished a 3-year randomized controlled clinical trial. So we took 500 cows who were mobility scored every 2 weeks, and they were treated if they became lame. They were randomly allocated to one of 4 groups. Group 1 had a treatment trim and block if they needed one. Group 2 had a treatment trim and block plus 3 days of non-steroidals every time they were treated for lameness. Group 3 had the trim and block, 3 days of non-steroidal when treated for lameness, plus 3 days of non-steroidal every time they calved. And group 4 received 3 days of non-steroidal only. They had no trimming. Now, the important difference with this study is that animals remained in their treatment group for their entire life. So historically, a lot of the treatment studies have just intervened at that single treatment. Here, an animal was allocated to a group as it calved and then followed for the rest of its life in that treatment group. So for example, a heifer which was allocated to group 3 would receive non-steroidal every time she was identified as lame and every time she calved. And then that allowed us to track what the impact of that would be. And I can't show you the results yet, but they are very profound. In heifers, which are tracked through life with these treatment regimes, group 3 animals had much less lameness through the rest of their life and were much less likely to be culled. So a combination of non-steroidal both at treatment and when animals calve seems to lead to profound long-term lameness benefits. That study hopefully will be out shortly. So I want to finish by reminding you that we think this is a chronic downward spiral, and I will gladly take any questions that you may have.
Er der nogle spørgsmål til Jon? Thank you very much for your presentation, Jon.
You're welcome.
Any questions?
Hi, I have one. I'm Peter from Sigas here in Denmark, and a couple of years ago we did a survey on veal calf looking for soul hemorrhage, and there was quite a high prevalence of those bulls at slaughter time with soul hemorrhage. Around 70–80% of the bulls had soul hemorrhage.
Yeah.
It's different between the bulls that were kept on slatted floors had more soul hemorrhage than bulls on deep straw bedding. And of course, the environmental factors might be useful to explain, but of course the calving factor is not
Yes.
a factor for those bulls. So what could the explanation be there?
Yeah, it's a really good question, Peter, and it comes up a lot actually when I talk this through. I would say two things. Firstly, I honestly don't think we understand a lot about beef animals, particularly in the intensive systems, and what is leading to disease, because they've been poorly researched. So it's difficult for me to say a lot from a research perspective. What I would say is that they are still subject to the environmental factors. So the environmental factors alone are definitely capable of causing probably the milder forms of clawhorn lesions. You know, we see it in bulls. You know, when we treat bulls that have been doing a lot of work in dairy herds, you will see some clawhorn disease. But again, they're spending a lot of time putting a lot of pressure on their feet. So it would imply that the environmental factors are capable on their own of causing clawhorn disease. And again, some of the studies which have tried to prevent cows from lying down have demonstrated that you can cause disease. So there's probably an environmental component. Secondly, the other thing I should have been clear and say is that the laminitis theory, just because it's been discounted as a cause, or just because I discount it now as a cause of the more chronic clawhorn disease we see in dairy cows, it doesn't mean that the acute grain overload animal which goes lame, so an animal which breaks into a feed store and gets very profound rumen acidosis, it doesn't mean to say that they also won't go lame, because they do, but that's acute rumen acidosis, and those animals definitely become lame. I don't think it's been demonstrated that is because of the previous theory, but it definitely makes them lame. But it's more that was one of the extrapolations from the original theory. It just doesn't seem to add up in the situations we see in dairy cows.
Okay, thanks.
Er der flere spørgsmål til Jon? Her på faldrebet.
I have a question.
Hi, Anne.
Can you hear me?
Yes, I can, Anne. Go
Okay.
ahead.
Yeah, thank you. Thank you very much for your presentation. It was interesting. You talked a lot about body condition, and we do a lot of measuring of body condition at calving and before dry period. What would you recommend for body condition at calving, and is it would it be maybe better to increase body condition during dry period if we're not thinking about metabolic disease?
Yeah, it's a really critical question, Anne. It's an excellent question. So what the research suggests is that there's two risk factors. One is the amount of body condition score loss is a risk factor for lameness, and that is around a 0.5 point body condition score loss. So animals which lose more than a half condition score point are at increased risk of developing lameness. It also demonstrates that those who just become thin, no matter how much they lose, are also at increased risk. And the cut point is around 2.25 on a standard body condition scoring. So both absolute thinness for being thin and losing body condition are risk factors. But there's one really important, or two really important howevers. The first is that when I speak to my colleagues who specialize in nutrition, they say in the modern high-yielding Holstein, there is very little we can do to prevent that loss of body condition to peak yield. It just now is part of how those animals work. So it then gets quite challenging as an intervention on farm. I mean, clearly what we should be doing is doing everything we can to manage nutrition carefully, so as few animals as possible lose a lot of body condition, but they're just going to do it. It's what they do now. So that's the first caveat. The second one is we then went on, having done the body condition score work and demonstrated that it was a risk factor for the development of disease. We then went on to do an analysis called population attributable fraction. So that's a very posh way of saying what the analysis does is work out what the relative risk of disease caused by a range of different risk factors. So I'm going to use an analogy. We know there are a range of things that lead to increased risk of us being seriously injured in a car crash. We could all list what the risk factors for being seriously injured in a car crash are. They are conditions on the road, they are the safety rating of the car, they're whether we're wearing a seatbelt, they're whether we are impaired by drugs or alcohol, they're how fast we are driving, and so on and so forth. There's a great big range of risk factors for that condition. And what population attributable fraction does is it quantifies the magnitude of each risk. So it goes, here's your top risk, here's your second risk, and so on down through your risk factors. So, you know, that's why governments focus on, for risk of being seriously injured in a car crash, they focus on wearing a seatbelt, speed, and not being impaired by drugs or alcohol, because those are the big risk factors when it comes to that scenario. So you always start with the highest risk and then you work your way through the list. What that demonstrated was it absolutely is right, the body condition score loss is a risk factor, but it's not a major risk factor. So it absolutely causes disease, but there's other things which are more important. So if I was focusing on farm, I would be focusing much more on environmental management, particularly around calving and particularly around first calving, because that's where the majority of the risk seems to lie. I hope that makes sense. It's quite a complicated story to explain.
Thank you very much.
You're welcome.
Er der flere spørgsmål til Jon her lige på faldøjeblik? Det lader ikke til at være. I don't think there's any more questions for you, Jon.
Right.
Marianne, would you say thank you?
Yes, thank you very much. It was very nice to organize this. You were very good at answering all the questions, and very nice you could stand up come up so early this morning.
Now,
So-
well, I hope you've seen the sun come up on a spring day in New Zealand behind me as we're.
Yeah.
Yeah.
It's very dark here.
Yeah.
Yes. Thank you. very
Okay.
much.
Well, thank you very much for the invitation. I hope that's been helpful. If anybody has any further questions, you're welcome to email me, and I will do my best to respond. And equally, a lot of if you're interested in more of the science and the research, if you want any of the papers and you can't get access to them, if you email me, I'm very happy to send them back to you. So just let me know. Marianne should have my email, but if you just Google Jon Huxley Massey, you'll find my email address, I'm sure.
Thank you very much.
Thanks.
I guess your workday is starting now then.
Yes, I'll do my day job now.
Yeah. Thank you.
Good night.
Good night. Og tak til alle jer andre for at lytte med. Det var bare den første af 3 præsentationer, der kommer ind igen om 14 dage. Vil du sige lidt om det, Marianne?
Det er om eftermiddagen, det er klokken 14, og det er en tysk dame, der vil tale om digital dermatitis. Charlotte Krøger, hvis jeg udtaler hendes navn rigtigt. Yes.
Ja, tak for i aften alle sammen. Vi ses om 14 dage.